Hello everyone, myself Ankita Tripathi, working as an associate professor in AMT College of Pharmacy. Today in my video lecture, I'm going to tell you about what is hypertension and what are antihypertensive drugs. Before moving to hypertension, let's have a quick overview what basically a blood pressure is. Blood pressure is defined as a pressure exerted by the blood on the wall of arteries. Blood pressure is generally of two types, systolic pressure and diastolic pressure. Systolic pressure is also known as contraction pressure, and that is maximum pressure or at the higher pressure. Diastolic pressure is also known as dilation pressure or relaxation pressure, and it is minimum side. Hypertension, blood pressure causes two kinds of diseases. One is hypertension, and second one is hypertension. Hypertension is that when the blood pressure is maximum or higher side. This commonly is known as hypertension. And when blood pressure is lower at the side, this is known as hypertension. This is the RAS system diagram representing how the hypertension occurs. When we come about the RAS, let's have a quick on what the three words means. That is RAS, that is renin, A for angiotensin, second is aldosterone, and S for the system. The system having three like RAS, angiotensin, and aldosterone. Commonly, how they are causing hypertension is the system basically will tell us about. In renin, angiotensin, aldosterone system, renin releases when the pressure of renal is low. Means ये भी कह सकते हैं when the pressure at the kidney is very low, the kidney releases renin. This renin, when releases from the kidney, reaches out the blood and get the order to liver to release angiotensinogen. This renin reaches to angiotensinogen and get it converted into angiotensin 1. As angiotensin 1 is a prototype, or we can say that is unstable and do not show significant amount of action. So it need to be get converted into the stable form. For the conversion of angiotensin 1 and angiotensin 2, we need an enzyme that is ACE, that is angiotensin converting enzyme, which is released from the lungs. What how exactly happens? See, when the renin binds with angiotensin, it get converted into angiotensin 1. As angiotensin 1 reaches out the blood, the lungs releases ACE enzyme. With this ACE enzyme, then go and stuck with the angiotensin 1 and get it converted into angiotensin second. Angiotensin second is a potent vasoconstrictor. It directly causes a contraction of the blood vessels, and apart from that, it also it stimulate or activate aldosterone, adrenal corticosteroid for releasing aldosterone. As angiotensin 1 get converted into angiotensin second, angiotensin second causes a vasoconstriction effect that is directly go and constrict our vessels, and which minimizes the area or the passage for the blood movement, and the blood pressure, one of the kinds, increases. Apart from that, angiotensin second also reaches to adrenal cortex and get it aldosterone to be get it released. This aldosterone is an hormone which is very potent, like sodium water retention. When water is retained in the body, it causes edema or the swelling. And when sodium chloride is released in the body, it go and stuck to the vessels elastin protein and causes its narrowing and ultimately block the arteries. This is what happens when the arteries is get narrowed or blocked. The blood don't get any space to move from this part to that part. That is why it causes the extracting of the blood on the wall. So thus hypertension occurs. This is basically how the RAS system help, or how the RAS system get being caused, or the reason of the getting cause of the hypertension. As I've already told you that hypertension is basically the maximum pressure exerted on by the blood on the arterial wall. Systolic pressure is generally a contraction pressure, and it occurs when the maximum like volume of the blood strike to the arterial wall. See, this is the diagram how the blood pressure occurs. Now coming to the antihypertensive drugs. The drugs which control or like stabilize our elevated blood pressures are known as antihypertensive drugs. Generally, these drugs have an like motive to get to be get to work on RAS system and get control the blood pressure entirely how it is being elevated. Now coming to the antihypertensive part, we have the different categories of the working. First is diuretics. Second is angiotensin and renin, angiotensin, aldosterone, system inhibitors, sympathetic inhibitors. See, we have already thought about that what is renin system is. Basically, the drug, the work which is working directly on the renin system will help as getting its control. Diuretics generally work on our uresis our urine. And sympathetic system directly work on the CNS and get it and control our elevated blood pressure. See, coming to the diuretics part, we have three categories as for thiazides, in which we have hydrochlorothiazide and chlorothiazide. Now, second is high ceiling, that is furosemide. Third category is potassium sparing, that we have spironolactone with us. Coming to the renin-angiotensin system inhibitors, we have ACE inhibitors. Generally, ACE inhibitor inhibit the enzyme ACE, which help in the conversion of angiotensin 1 to second. So we have captopril, enalapril, linsinopril, ramipril, etc. Coming to angiotensin receptor blocker, that is AT1 blocker. This system, what happens? It blocks the AT1 receptor to which and angiotensin second cannot be get to bind, and the rest of the process doesn't occur. In angiotensin receptor blocker, we have losartan, candesartan, valsartan, remesartan, etc. Third category is direct renin inhibitor. We have esclarin with us. They directly block the binding of renin with the particular in like a particular system, so that the entire process doesn't occur. We have sympathetic inhibitors, that we have beta blockers with us, that actually works on the hurt muscles and get our work done. That we have propranolol, metoprolol, atenolol with us. Then alpha plus beta adrenergic blockers, which it works both on the alpha and beta receptor of the hurt. Second is our alpha adrenergic blocker, but it works particularly on the alpha receptor. And second is centrally sympatholytic. It directly inhibits the elevated blood pressure. This is how the classification or the categories of antihypertensive drugs are. Coming to the mode of action of ACE inhibitors. By the name, we are getting ACE inhibitors, generally angiotensin converting enzyme inhibitor. By the name, we have got to know that ACE inhibitor will block or inhibit the enzyme ACE. As we have already studied that ACE enzyme, which is released from the lung, what is why it is being released? It generally convert angiotensin 1 to angiotensin second. And once angiotensin second is released in our blood, it causes vasoconstriction. And apart from that, it also stimulates adrenal cortex so that aldosterone can be released. If what happens, if this ACE inhibitor get blocked or get inhibited, ACE enzyme get inhibited, what will happen? The conversion of angiotensin 1 will not take place. It will not get converted into angiotensin second. And if angiotensin second will not be formed, then the vasoconstriction effect will not occur. Apart from that, aldosterone will not get be stimulated, so that aldosterone release cannot be done. So ACE inhibitor, they do? They generally go and bind with the ACE enzyme, get it blocked, so that the conversion of angiotensin 1 to angiotensin second cannot take place, and ultimately vasoconstriction effect get not started. Apart from that, adrenal cortex get not stimulated and aldosterone is not released. This is how ACE inhibitor works. Now coming to the second classification of our drug, that was the mode of action of angiotensin 1 receptor blocker. As we all know that after the formation of angiotensin second, it has two effects. It directly go and bind with its receptor and causes vasoconstriction. Apart from that, it also reaches to the adrenal cortex and get aldosterone to be released. Angiotensin second receptor blocker, what they do, they just bind with the receptor, which will be binding with the angiotensin second. What they do, the ARB blockers or angiotensin receptor blockers, they go and directly bind with the AT1 receptor and get it accommodated. After the release of angiotensin second, when angiotensin second will not get any chance to bind with it, that the further action will not take place. So angiotensin 1 receptor blocker, what they do, they bind with the receptor, angiotensin receptor, and they prevent the binding of angiotensin second with AT1 receptor. Thus, the further vasoconstriction effect or the stimulation of your adrenal cortex does not take place. This is how ARB drug works. Coming to the third point, that was the mode of action of renin inhibitors. As we all know that kidney releases renin, and this renin binds with angiotensin 1, angiotensinogen, and form angiotensin 1. Angiotensin 1 was the renin. In short, we can say that renin is generally responsible for the entire of the process. If we block the renin, the entire process will not take place. So renin inhibitors, what they do, esclarin, what they do, it go and directly binds with the renin and inhibit it. The inhibition of renin does not cause the formation of angiotensin 1, and further the RAS system does not occur. This is how escalarin work. They generally go to renin, they bind it and inhibit the action of renin. Ultimately, the renin will not combine with angiotensinogen to get angiotensin 1 to be formed. This is how the renin system work. Coming to the fourth point, that is verapamil. Verapamil is generally like a calcium channel blockers. What generally calcium channels do? See, calcium is responsible for the like contraction, the maximum contraction, maximum blood flow, maximum wall striking, and higher the blood pressure. So the verapamil, what does they do? They go and binds with calcium channel and block it. The blockage of calcium channel inhibit the influx of calcium ion inside the heart or the muscles or the vessels. Ultimately, the contraction of the muscle is get prevented and ultimately the pressure is reduced. This is how the verapamil work. Basically, calcium is responsible for the contraction, and verapamil inhibit the channel to increase the influx of the calcium ion inside the. Thus, the blockage of a calcium channel will prevent the influx of calcium inside the heart muscles, and ultimately the contraction will be prevented. When the contraction is prevented, blood pressure will be minimized. Coming to the fifth point, that is mode of action of parazoshin. Thus, we have studied that the sympathetic inhibitors, alpha receptors, what they do, parazoshin just bind with alpha. They are generally the alpha 1 receptor blockers. They generally binds with alpha 1 receptor and block it. The blockage of alpha 1 receptor causes the decrease in IP3 and DAC pathway, and they directly dilate the constricted vessels, and hence the blood flow increases and the blood pressure is minimized. This is how the parazoshin works. They generally go and binds with alpha 1 receptor and inhibits it. Ultimately, the blockage of alpha 1 receptor decreases the amount of IP3 and DAG, and thus causes vasodilation. Once the vessel size increases, blood flow is normalized and blood pressure reduces. And the elevated blood pressure reduces. Now coming with the last point of our discussion, that is propranolol. Propranolol generally is a beta 1 blockers. Beta 1 blockers, as we all know that the sympathetic system have two receptor, one is alpha and the second one is beta. Beta is also directly responsible for the elevated blood pressure. What happens if we directly block the beta 1 receptor, the camp level will increase. Once the camp level increases, ultimately the calcium on calcium influx inside the heart muscle decreases. So the muscle contraction will not happen, and our cardiac output and the blood flow will decrease, and ultimately our elevated blood pressure will be minimized. So what does this propanol do? This propanol go and binds with beta receptor, block it. The blockage of beta 1 receptor causes a decrease in the camp level. The decrease in the camp level causes a decrease in the calcium influx inside the heart muscle. The decrease of calcium influx inside the heart muscle will decrease the contraction pressure, and ultimately when the contraction of the muscles will decreases, and our blood pressure will be minimized when it is elevated. uh, I hope you all have understood the exactly the top, what I was going to try to say. And for further query, you can go and take admission to Amity College of Pharmacy. Have a good day. Thank you so much.